It's Mixed Mornings with Darren on the new Mix 107.3 KGRS. And, some big changes coming to patients at Great River Health, but in a good way. So we got Dr. Michael McCoy. He's the CEO in studio to tell us all about it. Good morning, sir.
Hey, good morning. Thanks for having me.
Yeah, thanks so much for taking some time out of your day and talking with me about this. So I was looking at this. This is something I'm actually a little bit familiar with already. When I lived in Fort Wayne, Indiana, before coming here, our health system had it. Something called MyChart that you are moving your patients to. So for those who might not be familiar with it, I guess, give me the rundown as to why you guys are moving to the system.
So we're moving our whole electronic health record to a very common record called Epic. And the reason we made this very large investment of resources and time and energy and effort is that our previous electronic health method just wasn't going to be able to have the capability to offer the patient experience, the end user experience that we all deserved and the patients deserve. So MyChart is one of the very foundational great things about Epic. It's a patient communication tool. It's going to help patients take over the control of their electronic health record. We're going to start signing patients up as early as May 25th. We go live with our electronic health record on June 6th, but we will start May 25th with appointments and things. But this is a way where patients can view their test results. They can schedule appointments. They can communicate securely with members of the care team. Request prescription renewals and information back and forth, pay their bills online, just access their health information anytime via computer or a mobile device, and that information goes with them. So if they have a MyChart at Mayo Clinic or at the University of Iowa, or over half the hospitals now actually have Epic, they can do a single sign-on, and their MyChart from Great River can be shared with doctors they see elsewhere and vice versa. So that information follows them. And for the clinical team, one of the biggest frustrations is when somebody comes and you don't have all the information you need in a timely fashion. And this is just going to be better for the clinicians and care team also.
Improvement for everyone, so
Absolutely.
to speak. So,
Absolutely.
All right, so you said that starting in late May, this sign-up process is going to begin. Can you walk me through what that's going to look like?
So there's going to be a variety of announcements out there about how we're going to do that, but we don't actually go live with the electronic health record until June 6th.
Sure.
But on May 25th, we're going to actually kind of go live with a portion of it, and it's going to be like, if you're making new appointments starting May 25th, those are all going to go both into our current system, but also into Epic. So those are all going to be loaded ahead of time. And we're going to allow patients to start signing up with MyChart in a variety of ways that the marketing department's going to help us with. But there's going to be kiosks. There's going to be community events and forums. There's going to be, when you actually go into your first appointment, you'll be able to sign up then. And signing up before you actually are seen is going to be just the digital check-in process is going to make it much more patient-friendly.
So this is an important thing to kind of note, I think, is that if you're an existing Great River Health patient, you still need to do this sign-up process. Is that right?
Yeah, this will be a brand-new system. We had a patient portal before. It just wasn't that user-friendly. Yeah, and it didn't give the functionality that we're going to be able to do with this. This will be a markedly different experience for our patients.
Well, what about on your end, the folks at Great River Health? What are you hearing from your staff about this transition coming up?
There's a lot of work going on. We're almost on April 2nd, we'll be at our 60-day go-live readiness assessment. So there's a lot of work happening to get ready for this. But the staff, while they're working really hard, are very excited about this because they know the better functionality that we're going to have on the back end of it.
Awesome. All right. Well, if folks want more details, obviously just kind of pay attention. Maybe check out the Great River Health website if they want to keep up with that. Any other ways?
Absolutely. Great River Health website, greatriverhealth.org/MyChart. And that'll give them all the information that they would want.
All right. Dr. Michael McCoy joining us from Great River Health. Again, June 6th is when patients will be able to use MyChart fully. And when does the sign-up process begin?
It'll start May 25th. We'll start signing patients up.
May 25th. All right. Well, sir, thank you very much for coming by today.
Hey, thanks for having me.